Acute pelvic pain is the sudden onset pain in the lower abdomen of the pelvis lasting less than 6 months. It can originate from the gynecological, gastrointestinal, urinary, or the musculoskeletal causes. Gynecological causes like the ectopic pregnancy, life-threatening, severe unilateral pain, and the vaginal bleeding. Ovarian torsion, sudden severe pain, nausea, absent of the top blood flow. Ruptured ovarian cyst, sudden pain after the exertion may have the mild bleeding. Pelvic inflammatory disease, PID, bilateral pain, fever, cervical motion tenderness. Metal schemas, ovulation pain, mild cycle pain. Obstetric causes like the threatened miscarriage. Lower abdominal pain, vaginal bleeding, closed cervix. Placental abruption, third trimester, severe pain, and the vaginal bleeding. Gastrointestinal causes like appendicitis, right lower quadrant pain, nausea, fever, rebound tenderness. Diverticulitis, left lower quadrant pain, fever, and the constipation. Lower obstructions, bulky pain, vomiting, and the distension. Urinary causes like the urinary tract infection, dysuria, frequency, and the suprapubic pain. Urolithiasis, kidney stone, flank pain radiating to groin, and the hematuria. Musculoskeletal or the neurological causes, pelvic floor muscle spasm triggered by the stress or the injury. Nerve compression, scarcity, radiating pain, and the weakness. Clinical features and the examination. Onset, duration, location, associated symptoms like bleeding, fever, GI, or the urinary symptom. Pelvic pain like pelvic examination like the cervical motion tenderness and the axial muscles. Abdominal exam like a rebound tenderness and the guarding. Diagnostic approach like a pregnancy test. Rule out of the ectopic pregnancy. Pelvic ultrasound, ovarian torsion, cyst rupture, and the PRD. Urinalysis, UTI, kidney stones. CBC, CRP, ESR. Infection or the inflammation. CT, abdomen and the pelvis. Appendicitis, diverticulitis if the gynecological causes are ruled out. Management depends on cause. Ectopic pregnancy, method exit if stable or surgery if ruptured. Ovarian torsion, emergency surgery, detorsion or the oophorectomy. PID, IV or the oral antibiotics, ceftriaxone, doxycycline and the metronidazole. Ruptured ovarian cyst, analgesia, surgery if hemodynamically unstable. Appendicitis, appendectomy, UTI, antibiotics, nitrofurantoin, ciprofloxacin. Kidney stones, hydration, pain control, lithotripsy if large. Acute pelvic pain is sudden onset and lasts less than 6 months. Gynecological causes include the ectopic pregnancy, ovarian torsion, and the PID. Ectopic pregnancy presents with the unilateral pain, vaginal bleeding, and the positive beta HCG. Ovarian torsion is a surgical emergency, sudden pain, absent of blood flow. PID presents with the cervical motion tenderness, fever, and the discharge. Appendicitis can mimic the gynecological causes and requires a CT for the confirmation. Pregnancy test must be done in all appropriate age women. Pelvic ultrasound is the first line imaging for the gynecological causes. Treatment depends on the underlying cause of surgical versus medical management.